Hello friends, I am Prabhjot, your occupational therapist, and today I'll be answering your questions from my comment section about challenges related to drooling both in children and in adults. If you'd like to watch more videos related to child development and in neurorehabilitation, do subscribe to the channel, add the notifications bell, ring it, and also like and share the video so that it can benefit as many people as possible. I will be addressing these questions from a video I had posted a while back about drooling. I will leave the link to the video right here where I've mentioned a number of exercises and what are the common reasons why drooling happens in children and continues in children beyond 2 years of age. So the first one has shared their experience about, we have a 4-year-old who drools at about a level of 4 to 5. For your information, 4 to 5 means the child's clothes and even the surface around which the child is sitting are all wet, maybe the floor, maybe the table. And they have tried to apply this and they gave me a feedback that it worked really well for them, the exercises, and the drooling was controlled significantly. The next comment is about an adult. My husband, 70 years old, has the problem of drooling 24 hours, maybe because of denture problem. So what can be the guidance here? Which I already added in the comments, but also would like to inform you that with dentures, saliva production significantly increases in the initial stages specifically. So it's better to use something like mint or something that you can suck on, like boiled sweets. That really helps to control the saliva production. And if it persists for too long, it is important to get checked whether the dentures are too tall, they are too thick, or they extend too far in the corners of the mouth. I've had excessive saliva in my mouth. I've been told that when I talk, it impacts my speech. I feel that my mouth gets too full and the saliva is constantly churning in my mouth, and I fear because people will perceive me as far less intelligent than I am, and my accent is also ruined because of that. So for this specific reason, I have mentioned techniques in my previous videos related to oral placement therapy, which really help in drooling control, the saliva control from the mouth. You can click this here to check out the series of entire videos on oral placement therapy and what are the different tools that can help in drooling. My next comment is also interesting. My cousins are boys aged 8, 9 and 13. They only drool when they are sleeping and it smells very bad. I have to wash my bedding and pillows when they leave for school. The girls are the same age but they don't drool. It has got nothing to do with specifically being boys or girls, but yes, it has impacted them. So I suggested them here to change the position of sleeping, because the mouth is usually open when you either sleep on your tummy or you sleep on your back, when your mouth remains open, and that is usually the time when you tend to drool more. And it also leads to bad breath because the mouth remains open most of the time. So I suggested to them to use a sideline position and also practicing more of closing the mouth and breathing through the nose, because this is another challenge many people or even children face, that they keep their mouth open while sleeping because of which excessive saliva production happens. The same recommendation was given to this next person also. My boy is almost 3 now, drooling level 5, so wetting the surfaces. Mouth is fine, talks okay, but he doesn't stop drooling, and the only one in the class who has to wear a bib, which is frustrating. So he doesn't close his mouth or is automatically swallowing his saliva. So I recommended to them to facilitate more nasal breathing in the child, giving them activities where they keep their mouth closed. And there are again some videos related to how to manage oromotor, so in the form of games, because this child is only 3 years of age. So if your child is that young, playing some oromotor games which facilitate mouth closure and natural swallowing process helps more. For the next comment, I have some additional points to tell. My son is 3 years old, drools a lot. I'm so worried. He is a normal child, but what to do? And this happens only when the child is overexcited and sometimes confused doing a difficult activity. Now in this case, it means it is more related to the emotional regulation of the child, when the child is either too excited or too overwhelmed by the activity, then only it happened. So I recommended them two specific things different from what I have mentioned before. First is that they have to use it like a reinforcement. So playing a game where the child has to do the activity like a jumping activity over the obstacles, but the challenge is they have to keep their mouth closed. So they cross the obstacles, keep the mouth closed, and they get the reinforcement. Otherwise they don't if they drool and wet their clothes. For the next comment, again, I have some different technique to suggest. I've had a lateral lisp my entire life and recently started to correct it. My saliva formulation is increased significantly and tongue feels heavy to position. Tongue position usually feels heavy either because the tongue size is big or the resting position of the tongue is not correct, which should not be at the floor of the mouth here. Instead, it should be at the back of the upper teeth. So again, I have a tongue posture based video here. I will leave a link and you can follow the activities and how to correct the tongue posture inside your mouth so that this heaviness, this feeling of the mouth is filled with the tongue, it feels heavy, it feels like you are not able to clearly talk. All of these can be corrected. I hope addressing these queries proved helpful to you. Do add any comments in this video as well, or any queries or suggestions that you might have, along with watching all the videos that I left links to if you have challenges related to drooling. Also, don't forget to like the video and subscribe to the channel because I regularly post videos on child development and neurorehabilitation, and ring the bell icon for notifications. Share it as much as possible so that maximum people can benefit from it. We'll meet again soon. Bye.